Okay. Alrighty. So any particular questions regarding anything we talked about, first of all, on Monday? Anybody have any questions? You saw I posted the windshield survey. You have questions about what you need to do for that? Okay. So what about for this class? Are there any questions from the lecture that you listened to that you might have before we get started? Okay. You guys feel okay with everything as is? All right. Let me open this full screen. Okay. All righty. Well, so let's just talk a little bit about the community settings for the nurse in the community that's working in the community, and some of the settings that they're in. So I'm not going to go over everything I talked about in the lecture. That's just repeating the same information. But some of the areas to emphasize or to highlight is what you need to know about in terms of what in each of those different settings, there are some roles that, so it's the scope of practice, right? And that's really what is our guide, what we are allowed to do or not do in that particular setting. So the parish nurse, for instance, are they able to do, even though there are RNs, can they do treatments in a patient's home? And why not? Nikia, you're shaking your head no.
Even though they're nurses, they just can't do follow doctor's orders, because I guess they don't have the degree for that.
Well, it's not a degree. What is the reason that nurses that work in certain settings can't do certain things?
It's not in their scope of practice.
Right, scope.
Right. So there are nurses that, for instance, we talked about in the lecture, the parish nurse, they cannot do certain things because it's not within their scope of practice. There are other times when, so for instance, a nurse who might work in a adult daycare, senior center, they can't do certain treatments in a senior center, again, because they don't have a doctor's order, but it's outside of their scope of practice. So just be aware of the fact that nurses are guided by whatever setting they're in, what that they're permitted to do by law, legally, what they can and cannot do. And no matter where that practice is, if they are legally able to do something, that they have a doctor's order, because nurses cannot practice without physician oversight or a doctor's order. This person, okay. So if a patient wants to take an over-the-counter drug, like an aspirin or a Tylenol, and the nurse is seeing them, and let's say in a clinic, they can advise them to take that over-the-counter drug, but only if the physician gives that nurse the order to do that, to for that patient to take it. So it may seem very benign, say, oh, just go ahead and take some Tylenol for your headache. You still have to have that doctor's order. As a nurse, you can't just tell somebody to take Tylenol in these settings. And that includes in a patient's home, in a clinic, but if you have a doctor's order, then it's fine. Okay, so just make sure that you follow whatever you're allowed to legally under your scope of practice, and then also, if you are allowed, that you have a doctor's order for it. So in a school setting, a nurse may tell a child that they can take Tylenol, but they have to have that order, and they have standing orders, or it's within their scope. Okay. Does everybody understand that difference then? All right. So some of the other areas that we're going to talk about, and I'll put you in separate rooms today to do some CAM therapy activity. But what's important to know when it comes to CAM? What is CAM, first of all? Anybody?
Alternative methods to traditional medicine.
Correct. Right. So it's complementary alternative methods to traditional medicine. Sort of like East meets West because a lot of these therapies really are used in, as part of Eastern medicine. So what is the role of the nurse when it comes to complementary alternative medicine patients that are on CAM therapies? What is the important components for the nurse to know about?
Education for the client,
Okay, what kind of education?
interactions with disease, like maybe some diseases they have and other medications they take.
Okay, so medication, you're talking about medicines here. Okay, so when we do medication reconciliation, it is very important that we not only ask about what medicine they're on, but specifically asking what alternative, or people take they say, well, I take these, they're natural. Well, those natural medicines oftentimes have side effects and interactions and interference with our normal, with regular medication that a physician may prescribe. So it's very important to know as a nurse everything that a person is taking, both that's, and a lot of times doctors don't specifically order that a patient take melatonin for sleep. They may, but they may not. And somebody may just go, it's over the counter. They can go to the drugstore, buy melatonin and take it. But they really should make sure that the doctors, and then if a nurse is reconciling or assessing, that they tell them what that medicine is that they're taking. So that's very important, because there can be these interactions that could occur that aren't good interactions. They're bad. They can be bad for somebody. And so we'll practice that today. I'm going to put you all in groups again, and you'll look at certain complementary methods, and we'll discuss that. What else? What other considerations are there for you as the nurse when your patients are involved with other CAM methods for themselves? Can you think of some other? What about somebody who's getting acupuncture? Do you have to think about anything with that?
If they're on any anticoagulants?
Any what?
Anticoagulants.
Okay, so that might interfere with that. Are you going to tell somebody that? Do you think it's okay? Let me rephrase that. Do you think it's okay for a nurse to say to a patient, "Oh, you shouldn't do that. You should just follow the doctor's order"? What would be a better response for a nurse if somebody is on an alternative treatment? And then the doctor wants them to do a specific treatment, but they're doing something different. What would be a good nursing response?
I'll make sure.
Okay, so raise your hand. I think Kirsten, I saw your hand, and then we can go around and everybody can talk. Go ahead, Kirsten.
I was just going to say to tell them to make sure their primary care doctor knows the alternative medications or methods that they're on, that they're doing, that they plan on. or if they have questions about something.
Okay. So they should always let the doc know that they're on these alternative methods. So they'll tell the nurse can discuss it with the doctor, or they should tell the doctor directly. Okay. What other nursing go ahead, Christine.
I was going to say to just educate them on the procedure or therapy that the doctor was recommending to them, so they can compare and contrast which is better for them, as well as what Kirsten said, like you want to know, you want the doctor to know what they're on as well, so they can make the best decision for the patient.
Okay, good. Can you do both?
Depending upon what it is, I would think so, yes.
Sure. Yeah, I would agree. Does anybody disagree with that? Most of these methods are safe and therapeutic, but they complement. So that's why they're called complementary. What traditional Western medicine. So we want to encourage the patient to always tell you what they're involved with, but then also, you know, to make sure. I'm sorry, my phone just distracted me. I hate when that happens. Anyway, so yeah, they just need to integrate the two practices, make sure there's no harm that's being caused to the patient when they're involved in this, but find a way for them to be able to embrace whatever that alternative is that they're using. Many of these practices nowadays are used in the hospitals. They're using massage therapy for patients in the hospital, and it is reimbursed by insurance. So that's really, you know, we've come a long way in recognizing the value in using complementary medications and alternative methods for treatment. Stress relief is really an important component in our overall health. And so there are some of these, you know, yoga or massage, there's some of these complementary alternatives that really will help reduce stress. When my husband had foot surgery, he had some pretty extensive foot repair. In January, they actually admitted him for pain management overnight, and he was given as part of his admission packet, aromatherapy. So a little container with lavender that he could open up the tube and just smell the lavender to kind of help him to relax, because lavender is used as a relaxation. This was at Union Memorial where he had his surgery, and that's what they included in the admission packet, which I think is really awesome that they're doing that, you know? So again, you know, they want, particularly because we had such an opioid crisis, and still do, but you know, the pain management in the past, of course, was just automatically prescribe opioids. Now they're looking at, in addition to an opioid, to try and get somebody off them as quickly as possible, they're using some of these other, you know, aromatherapies and other kind of complementary therapies, which is, I think, fantastic. So yeah, so just, and again, we'll do some work on that in a little bit after we just sort of review everything from today's lecture. See if there's anything else on. So we talked about the different centers where nurses can work, and let's do this one. This was in. This is a school nurse. So this was in your lecture. It was the case study Sheila, who is the RN working as a nurse in a school, and Betsy's the 10-year-old fourth grader who has severe asthma and doesn't appear to know how to use her inhaler or how to avoid exacerbations in her asthma. So one afternoon, Betsy comes down to the nurse's office with a headache, and Sheila takes her temperature and finds that she has a fever. So Sheila involves her mother. Naturally, she'll call the parent, The parent, her mother's name is Sandy, and she suggests Sandy come and pick up her child from school. When Sandy arrives, she'll ask her if she has a few minutes to talk to her before she takes Betsy home. So kind of thinking back to what we talked about in the first lecture, how can Sheila use a simple family interview to establish a relationship with Sandy? What kinds of things would Sheila discuss with the mother? What can she talk to her about?
She can guide her on how to use the inhaler and work through how to use it with the child as well, so that both the parent and daughter can learn how to use it well and avoid these kinds of exacerbations,
Okay.
as well as
So-
possible triggers,
Hmm?
as well as possible triggers for her.
Okay. Very good. That's correct. So what else in this simple family interview might the nurse talk to Sandy about? What's that one question she wants to ask?
Ask her how she's handling things and kind of take a look and just kind of observe the relationship between the mom and the child and see the interaction. And that way you get a better idea of what's kind of going on at home and how she feels about doing the treatment.
Okay. What else would be a good question to ask the mom?
Who are in her home and the ages.
Okay, who lives in the home? Who else is in the home? What other children might there be? What are their ages? Does anybody else have asthma? Right? So she might want to ask what else is going on. What other stressors might be leading to this? How about is Betsy using that inhaler? Okay. So she wants to get into a little bit of understanding of what else is going on. What about the environment? What kinds of questions? How could she ask her about that?
If she has
Like
pets in
describe
home.
the environment, like do you have pets?
Mhm.
Do you have mold? Is it an older home? Is she outside a lot? Is there a lot of dust? That's any allergen related questions.
Okay. What's another really key one?
Pets.
Pets, yeah, but it's if anybody is a smoker in the home. So I always want to check to see somebody has asthma, if there is anybody in the home that smokes. And this again is the nurse having a short, direct interview or questions with the mother. She's not going to get into a whole lot. She or he, nurse, will not get into a whole lot of like, oh well, if there's there shouldn't be people smoking in the home. Instead, make a suggestion. If there are smokers in the home, could they smoke outside? So that the child's not exposed to that secondhand smoke. Okay, so again, trying to figure out what the environment's like and then somebody mentioned about outside activities for the child. Sometimes those activities can induce asthma, right? So we have to check about that. How much activity the child does in the outdoors. What would be a short-term goal or outcome for Betsy?
Knowing how to use
Well,
her
she
inhaler.
can demonstrate how to use her inhaler properly, just at that visit by herself.
Okay. Okay. So watching the mother and the child, and one of you mentioned about their interaction, but then also so the short-term goal was that you watch Betsy use her inhaler and she's using it properly. Because sometimes people aren't even using their inhaler properly. So you want to make sure that they're using it correctly. Okay. So that would be a short-term goal. What else would be another
Her ability
anything else?
to identify what her triggers are.
Okay, to be able to identify the triggers for Betsy. And so a long-term goal would also be that there is decrease in the number of incidents of asthma exacerbation. Okay, so that could also be a long-term goal. And she'll have decreased incidents. She recognizes signs and symptoms. So, okay. All right, so that was just an example of an intervention. And I see here that I actually, did you guys have the answers on your slides? Oh, you did. Well, you did good then. Oh my goodness. Okay. All right. So excellent. So that's just an example of of the role of a school nurse and the intervention that the school nurse has. Another one, which we can do again in our groups today, is a medication activity. And what is the role of a nurse? Maybe doing an education class with the elderly in a senior daycare center, or a senior center. They're not necessarily daycare, they're just senior centers in general. So we'll do an activity on the neighborhood med management as well. So so we'll play with that in a little bit. Okay. Let's see. So you guys feel comfortable with the different roles and the different settings for a community-based nurse? And you probably, you just finished mental health, correct? So did you have a chance to do any clinical and outpatient settings? I don't know if mental health is having clinicals because of COVID. Did you get a chance to do clinicals in mental health?
Just not outpatient. It was more inpatient.
Okay. So you did inpatient, but outpatient mental health services there are a lot of them. And so that is also an area. So you can see in some of these settings, they are very nurse specialty specific, such as mental health or pediatric outpatient centers, or even OB clinics, where, and so setting specific for specialty nursing. These nurse-run centers, many of them have been in existence for so long, including Lillian Wald Center, which was back in the 1800s. So the community outreach has been a factor for nursing and nursing practice for a very, very long time, and will continue to be, I think, even more so in the future. Okay, so if you guys feel pretty good about all that, we'll go ahead and move on to infectious diseases.
Ask one quick question.
Yes, by all means, please.
When you were talking about him and you were saying the MD and then the other doctor for other medicine, you said an EO. What is, I missed what that stands for.
D, Doctor of Osteopathic Medicine, a DO. So you will see in practice, most doctors are either MDs, medical doctor, or DO, Doctor of Osteopathic Medicine. The other one is N, as in naturopathic doctors. But they're the ones that there's not I don't know the numbers for NDs, but that is not, they don't typically practice in hospital settings that I've seen them, more in clinics. But DOs are right there in mainstream medicine. In fact, so I don't know if I've shared with you guys yet, but one of the things that I've done since I retired, besides continuing to teach community, is I joined the University of Maryland emergency staffing for COVID-19 at the field hospital. And that is an initiative. So that it's an initiative between University of Maryland and Johns Hopkins. And the physician who oversees it from the University of Maryland side is Dr. Charles Callahan, and he's a DO. He's a doctor of osteopathic medicine. And the doctor from Hopkins is an MD. But their practices are identical in terms of scope of practice. The only difference that I am aware of for a DO is they're much more holistic. So they look at not just treating the symptom, they do a lot of body and manipulative work. And so they are looking more holistically in the care of their patients than an MD. Now that's in general, that's the difference in their training, is this manipulative type therapies, which is different than a chiropractor. Chiropractors are not doctors. They are doctors. They are people with they can do manipulations, but that's different than a doctor of osteopathic medicine. That is part of their training, is these manipulative therapies. When my daughter, so in Philadelphia, there's a college, it's PCOM, Philadelphia College of Osteopathic Medicine, and they have services. So when my daughter was expecting her second child, she had tremendous back pain, and her nurse practitioner, her midwife, recommended that she go to PCOM and get this manipulative therapy that they do specifically for pregnant women to help relieve some of those symptoms, back pain, etc. So whereas usually MDs don't do that. The naturopathic doctors, they're kind of out on the fringes a little bit. They're being recognized more and more as legitimate. But back in the 80s, when I worked in the emergency room, this was in Quakertown, Pennsylvania, which is near Allentown. There was a clinic outside of Quakertown that was a naturopathic clinic. And so sometimes some of our patients would come to the emergency room, and they had been following an ND, a naturopathic doctor, at the clinics there, and they would use different therapies like, I just always remember the one came in and the doctor said, use coffee douches for, I guess they had pelvic pain or something. And, that didn't quite do it for them. So then, now again, this was back in the 80s. Life has come a long way in those 40 years, but that's how it was. And we're like, okay, well, so we were always a little nervous when we would have people come to the ER that had been followed at this clinic. I am a true believer in natural medicine. I am a true believer in, healthy eating, organic food, that kind of thing. But that was a little extreme. And so anyway, that was just an example of what an ND had recommended for a person who eventually did come to the ER because their symptoms were not being managed properly. They had a problem and they were trying to treat it with these coffee ground douches or something really bizarre. So anyway, so that's a long-winded answer to your question, but
Thank you.
if you work with a DO, they are absolutely legit, right on par with MDs. So I'd be a little cautious with NDs, but DOs are right there in the mainstream of medicine. Like I said, Dr. Callahan, he's running these centers, the field hospital and the vaccine clinics and stuff at the convention center. So, which is really a great segue into global health and communicable diseases. Well, into communicable diseases. So so I talked to you about a couple different kinds that you need to be, familiar with are the flu viruses, okay, which are the H1s or the H2s. So it's the H and the N antigens that and some of them have, as I said in the lecture, the 3 that became pandemics in the 20th century, the one being the flu pandemic, the Spanish flu pandemic in 1918, which, you know, different communicable diseases. So in emerging infectious diseases, you maybe have heard that term. That's as the world becomes more global because of trade, because of travel, we are seeing these diseases that maybe at one time were just contained in one area of the world now are spreading because of, like I said, trade as well as travel. And so with the Spanish flu pandemic, that became a pandemic, and it was because it happened during World War One, and soldiers were going from, you know, country to country during the war, and a lot of the people who died were young. That particular flu affected young people more than the elderly, and they were dying in record numbers. And again, it spread across the globe because of the military operations going on throughout the world during World War One. So just be, you know, again, what is the nurse's role when we talk about influenza? When we talk about any communicable disease, really, what are some of the key roles for the nurse in the management, the prevention, et cetera? What are some of the key roles?
Education,
Okay, so what kind of education, Bridget?
like hand hygiene.
Okay. Okay, and where is that? Does that, so hand hygiene is absolutely number one way that we can, anybody, not, well, can everybody in the world easily wash their hands?
No.
Not if they have issues with water supply.
Not if there's problems with water supply, whether it's lack of water or water that's contaminated. So how do they wash their hands? So yes, it is absolutely one of the keys to preventing the spread of illness and infection is through hand hygiene and hand washing. But we also have to remember that in certain parts of the world, people aren't able to even have access to clean running water to wash their hands. So, but yeah, you're right. That is one way. What else?
For education, the different types of transmission, versus, you know, just teaching the different ways that you can possibly contaminate yourself or others with the disease.
Okay, so so can you break that down a little bit more? So what sort of things would you be teaching? So someone who lives at home.
So if, for example, like direct versus indirect contact, and you know, if it's a shared space, you know, like want to clean up after yourself, wipe down countertops and commonly used objects, you know, faucets, door handles, light switches, and then like that's more like indirect, like just cleaning up surfaces. And then like airborne, so that means like literally separating yourself, like negative pressure. I'm thinking a lot of like COVID wise, just like completely closing the door and one person at a time kind of do your thing and don't kind of share the same air type isolation.
Can bathrooms be shared?
As long as you properly clean up after yourself and you let it air out after a little bit and clean down the commonly used surfaces.
So someone who so what are some of the conditions that may cause the spread of the diseases? So
Like-
congregate living, right? So if there are a lot of people living in a household, there's a greater chance that the disease can spread because of that closer living environment. So in your own home, you would try to isolate yourself from the rest of the family members. by quarantining, absolutely quarantining, for certain TB or COVID. Now, influenza, hand hygiene, we want to teach. Also, what about when we cough? You want to teach to keep their mouths and nose closed. If they're blowing their nose, that tissue goes directly into a bag, not left out or whatever. So, but when people are in congregate living situations, such as group homes or any kind of rehab facilities, jails, homeless shelters, those kinds of places, that's where disease will spread even quicker. So when COVID occurred, one of the other initiatives, which was part of the University of Maryland, was that they are in a partnership with the Baltimore County Public Health Department, and they took over the Lord Baltimore Hotel downtown. And in that hotel now, it's now called the Lord Baltimore Tri-Center. And they have 2 floors that are dedicated just to the homeless. So those people that live in homeless shelters now are living at the hotels, either as a family in a room or as an individual, but they're all in separate rooms. And the same thing occurs there. And the homeless people, I know this because I work there as well with this emergency staffing, but they are, the homeless folks from the shelter don't necessarily have COVID, but they are being housed there to prevent them from getting COVID in the first place. So they are on their own separate floors, and they call it the Haven. The other 3 or 4 floors, depending on the census, is used for homeless people who are on the streets. They've taken people off the streets and put them in rooms at the hotel, again, to prevent the spread of the disease. People from all kinds of rehabilitation clinics and facilities, group homes. I never knew Baltimore had so many group home living situations. But as soon as someone would test positive in one of these facilities, all of the residents of that facility then that had contact with the person, all of those residents then are moved to the Lord Baltimore Tri-Center to be observed for the 14 days. They're quarantined if they're positive, 10 days from the time the symptoms are managed. And they're tested continuously while they're there to make sure that they haven't gotten the disease. So we have patients under investigation, people under PUI under investigation, or people with COVID-19, and they're all taken care of at this hotel, which is fascinating because one, it's stopping the spread of the disease, but it's also, you still have all your nursing care that you have to provide. So to visit these residents in the rooms at the hotel, you go to areas called the hot zone, and you put on full PPE, every, head to toe, and you go and you knock on their doors and you check in, how are they feeling, and do they have any COVID symptoms? And we do a lot of testing there until their quarantine is over, then they can be discharged. When they're admitted, like one day when I worked, there was 14 people admitted from one facility. They come into the hotel through the loading dock. Many of them are on Suboxone and other methadone type treatments for drug addiction. And so we have to do medication reconciliation right there before they come in to their rooms. Anyway, it's just this great operation with so many people from the city, as well as social workers, nurse practitioners, RNs, nursing assistants that help to manage all this. So they come in, we have to, a van usually brings them to the loading dock. They each have their bags with all their medicine, and we have to be outside on the loading dock reconciling all their medications before they can actually go up to the room, so that we can make a, put it in their chart. This is the medicine that this person is on, this one. And so we monitor their medication the whole time too. So it's really, it's a fascinating initiative, but it is really helping to stop the spread of disease. So as nurses, we also educate them while they're there, and we offer them other vaccinations. And now they have a vaccine initiative going on at the hotel as well. And again, it's to help stop and slow the spread of COVID in the situation there at Lord Baltimore. So if anybody's interested, they are always looking for people to join the emergency staffing, and they have non-nurses that are the helpers there. So it's pretty cool. But anyway, so talking about communicable diseases. So as nurses, we talked about the fact that you are doing education about hand hygiene, and then, in the home, and not sharing things, and keeping everything clean and wiped down. What are some of the other nurses' roles in communicable diseases and helping to stop the spread of or control the spread of disease?
Education about vaccines.
About vaccines, absolutely. Okay, good. Did you guys watch the video that I had posted that was from Baltimore about the student that had COVID? And it talked about all that. Now, when that came out, vaccines were just beginning. I don't even know if they were approved at that point. But yes, vaccines are, we have to educate about vaccines. There's a lot of people that don't trust vaccines for a lot of historical reasons. They're very mistrustful. So we have to educate and try to diminish some of those beliefs and show with data the truth. What other roles might the nurse have in terms of communicable disease and stopping the spread of disease?
Making sure that they're compliant with their medications.
Okay, who's talking on that one?
Stephanie.
Oh, Stephanie. Okay, so medication compliance. Okay, which disease that I talked about in the lecture is really a big part of what a public health nurse outreach program?
Is it tuberculosis?
Yeah. Why? Do you know?
Because they have a longer treatment period. It's, I think, 6 months.
Yep.
So you have to make sure that's a long time, so people don't want to be on medications for that long. So you just have to make sure that they're, still sticking with it.
Right. So medication compliance for someone with TB in particular, because there are so many, what happens is people don't follow through on their full regimen, you get resistance to disease. So in the case of TB, it's 6 to 9 months of treatment. And if they stop their treatment, then that TB is going to morph into a resistant strain. So it's real, yep. So monitoring medication compliance is a huge role for the nurse. What else?
Testing.
Testing, okay, all right, yep. Christine, what were you saying?
I said the exact same thing.
Oh, okay, you guys said it together. Okay, so testing. And can you think of anything else?
Contact tracing.
Contact tracing, exactly. So contact tracing is really important. It's also surveillance, okay? So being aware of potential outbreaks that maybe are occurring and reporting there are specific communicable diseases that have to be reported to the health department. Not all diseases have to be reported, but there are certain diseases that have to be reported. So being aware of the potential when somebody presents, say you work in a clinic and they come in and or you work in the ER, but wherever you work and they present with certain symptoms that, and then you test them, like strep throat, that's not a reportable disease, but certain STDs are reportable, okay, as an example. So you have to observe and report and be aware that somebody could potentially have this disease, follow up, check it, and then report on it. So surveillance is extremely important. Vigilance, making sure that, again, as the nurse, that you're educating your patients about ways to prevent disease in the first place or how to stop the spread of the disease. Also being vigilant for potential bioterrorism. And we're going to talk about disaster nursing, which includes bioterrorism, in the 4th lecture. But being aware that there is the potential to use any of these different organisms as a means of creating great harm through bioterrorism. So being aware of that and surveillance. I have heard people make comments like, I don't understand why we would be sending vaccines to other countries when we need to vaccinate our own people. If you heard that, what do you think about that? Do you think that that's a true statement? Do you think that there's something else to consider when you hear something like that? What do you think, Ophelia?
Well, I'm just thinking along the lines of like it's a global thing. So like the world, people go from place to place. Like no one's in a specific place for, you know, however long. So like if you only focus on people in a specific place and other people that are infected are traveling from place to place, it kind of like, I don't know how to explain it, but yeah.
No, you hit, that's exactly right. That's exactly the point. We can't just vaccinate this, you know, the developed countries because they had the means and the infrastructure to get that vaccine out to their own people in their country. But when you're talking about a global, and that's what pandemic means, it's global. It means the entire world has been affected by this organism, by this disease. This is now a pandemic. We've got to vaccinate everybody. We have to stop the spread across the globe in order for it to end. So that means that we, as a developed country, not just the United States, but developed countries, share the wealth. We have to make sure that we are all in this together across the world. And so we have to, the countries that have the means should ensure that the countries that don't have the means still are able to get the vaccines and then vaccinate their people, which is a huge undertaking if you think about it. There are many parts of the world that are inaccessible or difficult to get to. There's a lot of mistrust. There's you know, it sounds like something you could just do, but no, it really involves a lot of organization, a lot of coordination among countries and governments. And even if you don't believe in big government, we have to have somebody has to be in charge, you know, somebody has to sort of oversee this. So we do have organizations such as the World Health Organization that are monitoring the health of the world. And and, you know, coming up with plans and ways to make sure that everybody has the ability to be vaccinated against this particular, in this case, COVID-19. And that's the only way that you'll ever really stop the full spread of the disease and stop the pandemic, is by ensuring that everybody does get a vaccine or gets vaccinated, or at least that you know the term herd immunity. Have you heard that word? They use it a lot in the media. Herd immunity is when enough of the population has been either the antibodies or has had the vaccine, so that it stops the chain of infection, which I talked about in the epidemiology piece. So if you can stop the chain of infection, meaning that the host, or, you know, when it enters somebody, if they've been vaccinated, the disease cannot continue. So we got to stop that. And if you get enough people with the immunity, either through vaccine or antibodies, because they maybe have had the disease, you will reach what they call herd immunity, which will help to stop the spread. So in third world countries, communicable diseases are still the #1 cause of death. And again, it has a lot to do with infrastructure, economics, you know, getting to those people in third world countries that economically cannot afford to have the same infrastructure that we do in you know, our country. But the United States now, infectious diseases that once were the #1 cause of death no longer are. It's chronic diseases. So it kind of goes back to what we talked about in class 1, that we have to now chronic diseases are the #1 killer of people in the United States. What can we do to stop the proliferation of chronic diseases, health, wellness, etc.? Okay. Let's see. So nurses also, we have assessments, which we talked about, the education, the surveillance. There are different levels of the prevention. So some of the primary and I talked about that, and there's a slide that talks about primary, secondary, and tertiary prevention when it comes to talking about communicable diseases. I also just recently read, and I may have posted it, but there was an article from the CDC that actually the incidence of TB, which had really started to go up in the 80s because of HIV and so many people with lower immune system immunity. TB right now, ever since the pandemic last year started, is actually the incidence of TB is going down. And that makes sense, right? If you think about it, we have less interactions with other people. There was much less in terms of travel when everything shut down a year ago. So TB, just by virtue of shutting down everything and less interaction with other people, the incidence has gone down tremendously. It'll be interesting to see what's going to happen now that things are starting to open up again and people are back traveling, and you know, we'll see what happens. There will be another infectious disease that will come after COVID-19. This is just you know, there, as you saw, or as I said in the slides, you know, we have infectious diseases. We've had 3 pandemics in the 20th century. We've had 1 pandemic and 1 almost pandemic in the 21st century already. And then of course we have COVID-19, which is the second and a great pandemic, but we had swine flu in 2008, I think it was. So just be aware of the increased chances of them occurring. Actually, I was watching 60 Minutes Sunday night, and they had something about, they now have this one doctor who's from Dartmouth, said that they have the means now to stop, because of the mRNA, which is what the COVID vaccine, Moderna and Pfizer, you know, it's the messenger RNA, is what they're using now, which was a technique they were already working on pre-pandemic, which is why that vaccine was able to come out so quickly. But anyway, this doctor was saying they now have the technology and the means to stop any infectious disease from becoming a pandemic, because they have the technology and the means through this research that they've been doing. Whether or not people will accept that is a whole different story, but I thought that was very interesting that, at least according to this one researcher, he felt that you know, we can stop the spread of infectious diseases across the globe right here and now if we wanted to. So we'll see what happens. You know, I hope he's right. I hope that people hear that. The other component that a nurse wants to educate patients about, and this is really important as well. If you listened to that video, that short video on the COVID, building bridges, the student who was from Baltimore that was interviewed and had COVID and was really very sick, they talked about stress and the role of stress in our lives, and in particular with COVID-19. So people that have very stressful lives seem to be, you know, again, it lowers your immune system. So as nurses, we want to educate patients on stress reduction and ways to do that. And some of them might be through CAM, right? There's lots of ways we can talk about how to reduce our stress in our life, because that too can contribute to an inflammatory response, a lower immune system, you know, ability to fight off disease. So that's another part of the education that a nurse can participate in with people. I'm just looking to make sure I. Okay. All right, my friends, does anybody have any questions? Otherwise, I'm going to go ahead and put you in your breakout rooms again. Did you see I posted the groups? So it's your clinical groups. So there's 3 separate groups. Karen, Antoinette, Ophelia, Dana, and Christine is group 1. Group 2 is Stephanie, Hazel, Pearl, Ari, and Sony. And then group 3, Angela, Kirsten, Kelly, Bridget, Caroline, and Rose. Is that right? Sound about right? That's the list that I was given. So that's the group that you're going to work with to do your windshields surveys. But I'd like for each of you to do your own, and then you'll get together and talk about it, what each of you found, compare, contrast, and then put together your presentation. The first group did a lot of the students did it as a PowerPoint, and so that's fine. And you can share that with your, you know, with everybody. We'll do that the 4th lecture. So you saw my message. We don't have class next Monday because that is when I'll be up in Philadelphia for my aunt's funeral. So we'll have class next Wednesday and then the following Monday, and then your exam is on the following Wednesday. Okay. And your case studies will be due on the 26th, which is a Monday, and the exam is the 28th. All right. So, but they will be opened up. Case studies will open up after Wednesday, next Wednesday, when we have our home care hospice case management lecture. And that's the lecture because it is about case management and the role of the nurse as a case manager and discharge planning and transitions of care that will help you with completing the case studies. So they'll open up right after that class. Okay. All right. Okay. So let's see if I can work through this again. Let's see. First, I have here. So here is, this is the actual activity. for what I want you to do in the, I really have trouble with this. Sorry, guys. Hold on. So you see it on the screen, right? I'm going to put you in your groups again, and then you'll see, you can see group 1 will do chronic pain, etc. down, and then you'll report. So answer the questions 1 through 5 related to the actual assignment, whether it's for chronic pain, anxiety, common cold, okay? And then the last question is the pick one of the following, and your group can decide which of these, how would that be used for your particular topic? Describe the purpose and side effects of that therapy. Okay, so you can use your, look up things, and I'll give you, do you think 10 minutes should be enough? Or would you rather 15? What do you think? 10?
Probably 15.
Let's say 15. It took us a little bit last time.
Okay. All right. That's fine. So I'll go ahead and put you in your rooms as soon as I can get me back to full screen, which is always a challenge. Breakout rooms. Okay. I'm going to go ahead and do that. And then 15 minutes. So by the time it gets started, it'll be 11:05, 10, 15, 11:20. I'll bring you all back, okay? All right, so I'll do the breakout rooms. Okay. Oh, wait a minute. As soon as I figure it out, no, I have to add, I only did one room, I need to do more. Okay. Okay, I'm opening your rooms now. Everybody's there, okay? Okay, so which group is this now?
Group 1.
Group 1. Okay,
Pain.
group 1.
Share my screen.
All right.
There we go.
Okay, so we had chronic pain, and the therapy that we chose was acupuncture. The research said that specifically it works well for neck pain, back pain, osteoarthritis, joint pain, and headaches. It mentioned migraines as well as I think tension headaches. Then it also went in to say that it's used for other uses, but that's not, the research is not so specific on those. So acupuncture itself is the insertion of thin sterile needles into the skin at a directed body part by someone trained. Then we have the traditional Chinese definition, which is the technique for balancing the flow of energy for life, known as qi. It's believed to flow through pathways into your body, and by inserting the needles into specific points along these meridians, acupuncture practitioners believe that your energy flow is then rebalanced. So pros and cons of acupuncture, there aren't very many side effects. The treatment often has the patient increased energy, and then it's used in conjunction with other treatments. Cons are risk of infection. The needle could be placed improperly, leading to, nerve pain and other things. It takes time to feel the relief, and then there could be bleeding, soreness, or bruising. Then interactions would be anticoagulants, and then we just thought potentially if you were severely immunocompromised, since you are putting something directly into the skin, you then might have an interaction that way. And then nursing implications for patients using acupuncture would be to educate your patient on signs and symptoms of infection, as well as you, the nurse, assessing for it. And then as well as education on, you could say, what medications are you on, take a history of that, make sure they're not on any blood thinners, but also remind them that, just a simple aspirin is also a blood thinner. So even though it might not be a prescribed medication, they still shouldn't be taking that.
Okay.
And then number 7 was acupuncture.
Right. Okay, very good. So did you learn anything new from that? I'm just curious.
Yeah, I guess about, the improper placements, that they could cause more pain than it would relieve. That
I wonder what the
really
incidence is of improper placement. If someone isn't, was there any indication of that by any chance? Where
I mean,
where
I
it's
didn't
not done properly.
see in the research, I didn't see anything where it was like, oh, X amount of people feel that. But I've had acupuncture actually done. And sometimes there's a needle that they put in that, like, from the get-go, some of them you don't feel, and then some of them you feel and you're like, I'll get that one out. And it must hit a nerve or something, because when I had it done on for like headaches. He did it on my ear.
Yeah.
And he put 15 needles in my ear, didn't feel a thing. And then when I was younger and I pulled a whole bunch of ligaments in my knee and I messed my knee up, he did it on my elbow, and he did it on my knee. And there was some in the knee that when he put in, I could just I could not ignore the fact that it was in pain. So I had him remove those.
Okay.
It was interesting, but a few of them had a pinch that it was unpleasant. So
Yeah.
the one article mentioned if they put them in too deep, also.
Okay. Could hit a nerve more likely. Yeah. So how long are those needles? Are they an inch, quarter inch?
Oh, Some of them were, I mean, obviously for the ones that go in your ear, they don't go in very far. I mean, the needles are probably they're lengthy. I mean, they're probably upwards of like 3 inches maybe, but it's a matter of the depth in which they actually like put it into you. So like the ones that I got on my knee went in much deeper than the ones on my ear.
Yeah.
But and then he did some like, it was definitely like a holistic like Chinese medicine experience. Like
Mhm.
he did like auditory like stimulation, and he warmed the needles up. He had like I think it must have been like sage or something, and he like tried to warm the actual needles, so it was like heat therapy as well, so the needles would warm up a little bit.
Yeah.
Was in conjunction. Well, that was pretty cool. A little strange personally, but it was a pretty cool experience.
When I saw it done, the needle was in like a little plastic. It looked like sleeve,
Really.
so it covered part of it, and then it stuck out the top, and they would tap the top of it, and so when it reached the sleeve, they couldn't insert it any further. So that kind of allows them to only go as deep as they should, I guess.
Mm-hmm. Mm-hmm. And like you said, there's probably different size needles for different parts of the body, depending on how much muscle or tissue fat they have to go through.
My mom had some put in on her head one time. She like on her scalp, and yeah, it's actually not that bad. It doesn't feel like you're getting stuck 1,000 times with needles. It really doesn't.
Yeah, I imagine people that have a fear of needles would not do well with acupuncture. That probably would be contraindicated. Okay, thank you. Very interesting. How about group 2? What do you have? Group 2?
I can share my screen. Hold on one second. Is it showing right?
Yes, it is. Yep.
Okay. So we had anxiety, and we did several different instead of focusing on just one.
Okay.
So we had the biological based therapy. There was kava and valerian root. For mind body therapy, there was meditation, yoga, and prayer, and therapeutic touch. And then there's aromatherapy. And the research showed that in 2007, a survey was done. About 38% of adults and 12% of children used some sort of CAM, and people of all backgrounds used complementary medicine, but it was used greatly amongst women and those with higher education and higher incomes, just because the therapies, those specific therapies are tend to be more expensive or can be.
Right.
This year, what has been a little bit different because of the use of YouTube and things like that, where we can, a lot of people have put yoga and meditation and things like that on YouTube for free. So that may have changed this year. Not many men seek medical care unless necessary. So CAM therapy is a lot less used by men. And trends also reveal that there's been a significant increase in the use of specific CAM therapies like deep breathing, meditation, massage therapy, and yoga. And Americans spend nearly 34 billion out of pocket on CAM products and practices annually.
Wow.
But it's difficult to document the efficacy of CAM. Because of unique characteristics that do not lend themselves to traditional Western medicine. And CAM is usually very individually based, and it's not specific for just one problem. So meditation can be used for a variety of things, not just anxiety, that sort of thing. How and why is it used for the problem? Meditation is used to help with relaxation techniques. Valerian root is used to reduce anxiety and restlessness. Kava relaxes the muscles and promotes sleep.
What is kava?
Aromatherapy.
I'm sorry.
Aromatherapy. Oh. What was that?
I was just wondering what kava stands for. What is kava?
It was one of the medicines that we use that was in our pharmacology book.
Okay. Okay. Thank
I'm
you.
not sure if it might just be, I don't think it stands for anything. I think it's just kava.
Yeah, it's
I
a
see.
plant.
Okay. Thank you.
Aromatherapy promotes relaxation and sleep, and prayer promotes peace of mind and helps with everyday worries and stressors. Pros and cons of these therapies: valerian root reduces anxiety related to restlessness and causes drowsiness and lightheadedness. Kava decreases anxiety by muscle relaxation, promotes sleep, and is generally safe for use, but it can also cause liver damage, especially with people who have prior liver conditions, and possible allergies related to aromatherapy or any of these medicines. Interactions: kava causes sedation, especially when taken with CNS depressants. Valerian root, alcohol when used with both kava or valerian root can cause sleepiness and drowsiness and potentiate the effects of CNS depressants. The nursing implications: education on the fact that kava can cause liver damage. So ask the patients if they have any liver conditions. And valerian root, avoid driving or operating heavy machinery or equipment. And aromatherapy with the allergies, and kava and valerian root, there may be some allergies associated with those therapies.
All right. Very good. It's interesting that women are the ones that really are the greater users of CAM therapy. So there's something a nurse can do, is to educate the importance and the use of it, both for men and women, and how effective it can be. So very good. Thank you. Group 3. Who's group 3?
I'm
You
gonna
guys?
share.
Okay.
I can present it. Sorry.
Okay.
It's a little bit of noise going around in the background, so please bear with me.
All right. Is that the right one? Can you see it?
Yes.
Okay.
All right, so what is the therapy? We have common cold, so we chose a therapy that a lot of people use, zinc throat lozenges. What does the research show? So NIH states in 2020 that zinc lozenges, if taken within 24 hours of the onset of the common cold and for less than 2 weeks, can be useful and shortens the duration of the common cold symptoms. Why is it used for the problem? It shortens the duration of the nasal symptoms, body aches, congestion, sneezing, and cough. And it can also lower incidence of colds. What are the pros and cons of the therapy? So a con is it can cause nausea and GI symptoms if taken orally. It also can cause diarrhea. And if it's taken intranasally, which lozenges aren't, but I feel like it's important to know this, that can also cause loss of sense of smell. And a pro is it decreases duration of all the different symptoms of the common cold. Other interactions. So it said in the reading that it's just said certain antibiotics. It didn't list all of them, but and then it said penicillamine. I haven't really learned about that, so I'm not sure exactly what penicillamine is.
Not sure either.
I'm sure.
Honestly, but
Yeah, I was gonna say you may know that, but I'm not sure what that one is. I'm guessing it's a type of penicillin, but
that would be my guess too, but I've never heard it called penicillamine. I'm gonna look it up while you.
Right. And then, so nursing implications when the patient is using this type of therapy. So we would want to, educate the patient, let them know that they cannot use this longer than 2 weeks. If you use it longer than 2 weeks, it can cause urinary tract issues, a copper deficiency. It can cause anemia and damage to the nervous system if you use it longer than 2 weeks. And we know that the cold is a virus, so it can take its time and and we're trying to treat the symptoms because we really can't do anything to actually get rid of the virus. So that I know of a cold virus.
Right.
And then test for, we would maybe do some labs to see if they already have a copper deficiency or anemia. Because obviously if they had anemia already and stuff, maybe that's not something that we would want to have the patient do if they're already anemic or have some sort of deficiency. Pick one of the following. So we picked acupuncture. We didn't get a chance to talk about it fully because the session ended, but it can help build the immune system and relieving the symptoms such as the chills, fever, headache, runny nose, congestion, sore throat, and cough. Because I know that acupuncture is supposed to help your chi and move your chi. So if your chi, I've had acupuncture and they say like your chi is stuck in a certain place, and they help release that chi and get it moving again throughout your body. So
very good, very good. Thank you. Here's what I looked up: penicillamine. It's sold under the
thank you.
of cupramine, among others. It's a medication primarily used for the treatment of Wilson's disease. Also used for people with kidney stones who have high urine creatinine levels, RA, and various heavy metal poisonings. So that sounds like why you would, in your report, you said it would be you don't want people to use zinc if they're on penicillamine, and it looks like, the different metal things. I don't even know what Wilson's disease is, to tell you the truth, but anyway, interesting.
So we would do a med reconciliation and like make sure they're not on either of those any of those drugs. And
that is correct. That is absolutely correct. Yeah, you would have to make sure. So it is different than penicillin, but that's the first time I've ever heard of it. It's for the treatment. It's also used for the treatment of rheumatoid arthritis and is known as a disease-modifying anti-rheumatic drug to decrease pain and tenderness. Anyway, interesting. Thank you for that. Something new. All right. Okie dokie. Anybody have any questions or thoughts, remarks on that one? Common colds I see a lot of people do use zinc when they get a cold. I've always thought that it was kind of hocus pocus, but it sounds like there is research that's shown that it is effective. So that was good. Thank you. Group 4, you have cancer. Group 4.
Can you hear me?
Yes.
Okay. Yep. So we had cancer, and the therapy that we chose was mind-body therapy. So the research showed that mortality rates were up to 25% with people who had depressive symptoms and also had cancer. According to the National Institute of Health, research shows that mind-body practices have a positive effect on many systems in our body, improving quality of life, reversing the harmful effects of stress, and creating fundamental changes in the way the brain functions. So how it works is basically that these practices and the mind-body therapy can affect the neurotransmitters and basically like decrease the symptoms and help to manage the stress response. So such as meditation, art, music, prayer. And then the pros, we said decrease stress, potential depression. It's safe, non-invasive, and enhances coping. And then the cons, we said non-compliance, just because in order for this to be effective, you have to do it daily. And for people, that might be hard for them to do. And, with meditation, you might have to pay for it. It could get expensive. They might not relieve the pain that the cancer is causing. And some people just might not trust the process and just stop it altogether. We didn't find that there was any interactions and nursing implications. We said assessing and evaluating their progress, making sure the physician knows about the therapy, making sure that they're still continuing their medications, being empathetic, listening to what they have to say, and just being supportive. And then for this one, we picked guided imagery. The purpose is just a distraction technique to decrease stress, anxiety, improve their quality of life, and just increase relaxation. And we didn't find anything that said that there were side effects or any risk or anything.
Okay. All right. So what did it show, how many people, like the percent of people that are using these mind-body alternatives? For mind-body
I didn't see anything. Did anybody else see anything that was in my group? I don't think so.
Okay. So, all right. Well, I definitely would, for all the reasons that you stated, it doesn't cost anything, which is always a positive for people that may have, any kind of financial worries, that you would use a mind-body therapy to help with relaxation, and guided imagery, it goes along with that. So, yeah, so that's good. All righty. Well, I'm glad that we got through that, and that you hopefully will, again, keeping in mind the nurse's role when it comes to working with patients with CAM, and being aware of the different effects or side effects, and why someone chooses to uses a type of CAM therapy. So the other activity that I wanted to do with you is the neighborhood med management, but rather than this is one nurse who's a school nurse, so this one is posted. Why don't you, rather than us going into more breakout rooms, we'll end for now, but I'll ask that you take the time to just go through this, and then we can report back on next Wednesday, which is when we'll meet again, to just talk about it in general. It just really is a compare and contrast of how a nurse in a school setting versus a nurse working at an adult senior center would approach their patients or their clients, and talk about medication management. So there are some similarities, but there are also some differences. And again, it just shows the different role of the nurse in those different settings when it comes to medication management. So that class activity is on Blackboard. If you would just briefly go through those questions, and then we'll report back on that. Okay, so I think that's all that, and a lot of it actually on the first one, which is Violet, who is in the school system. And again, she has a child who comes to her with asthma. And so it's similar to what we kind of talked about already with the nurse working with Betsy and her mother, Sandy. So some of it we've already touched on. So yeah, we'll come back and we'll discuss that further on next Wednesday. Does anybody have any questions or anything to finalize this class today that you want to say? All right. Well, listen, I hope you guys have a good day. Wait, is there Yes, it's scheduled to open up immediately. I think I scheduled it. I'll tell you, yes, there is one and you'll have it available to you. The question was, is there a PowerPoint for the next class? And the answer is absolutely. And I believe it will open up as soon as we're finished here. So class 3, yep, at 1 o'clock today, it's scheduled to open up. So I can just go in and open it now if you want to get right into it. That's fine. Okay. So yeah, so both of the PowerPoints for class 3 and class 4 will be available to you today. Okay. The case studies, they'll be available after next Wednesday, because that's the 21st. Yeah. Okay. And you can start working on them at that point. There's a study guide that's been open, and I'll open up another study guide for you. Some of it will be applicable. You can look at it and use it now, and some of it you won't really, it won't mean a whole lot till after the next lecture, but I'll go ahead and make that available for you as well. All right. So are there any questions? I'm sorry, when did you say the windshield assessments are due? The windshield assessments are due, says it right on here. Presentations will be on Monday, April 26th, which is our 4th class. So we'll start with the presentations, or we'll go through the class information. We'll do the presentations, and that'll be our activities for class 4. Will actually be your windshield presentations. Okay. So those need to be then submitted by Monday. I'm looking to see if there's a date. Yep, by 5 p.m. on April 26th, your windshield surveys that you individually will do, you'll submit them as under windshield assignment on Blackboard. And the presentations will be on the 26th, on that Monday. Okay. All right. So yesterday, just real quick, I was here. I'm going to end the class for now.